Excellent. Well, welcome everybody. I'm glad to have everybody joining us today. We're here today to talk about why vaccines count and why we want to talk to women and families about getting vaccines. It's part of a program the March of Dimes does. It's called It Starts with Mom. And this segment of It Starts with Mom is about protecting you and your family from flu and RSV. As we know, we're going into that season when we're going to be meeting with our families during the holidays and be indoors, and the winter seasons are upon us. And we know that this is the time where flu and RSV seem to be most prevalent. So we thought it would be a good idea to have this conversation. And really, it is just that. It's a chance for us to talk about why each one of us, from our perspectives, care about vaccines and care about making sure that our friends and family are protected, and give us a chance to just get to know each other and talk a little bit more about it. So I think what I'll do is call on each one of you, talk a little bit about who you are and how you came to the table, and then jump into your personal story as to why you're here. And I will start with Brittany, if you don't mind.
Sure, that's no problem. Hi, everyone. I'm super excited to be here today. I am actually a mission mom, so I have a connection to the March of Dimes, and I also am a store manager for Walgreens. So we do immunizations and vaccines day in and day out. So I'm super excited to be able to have a conversation with you today to really explain those benefits and really just share my soul with you.
Great, thank you. So thinking about what you just said, can you tell us a little bit about your personal experience with vaccines, and then also how that dovetails a little bit into your professional life?
Sure. So my personal story is I have premature twin boys. They were born at 30 weeks, and we spent 6 weeks in the NICU. During that time, it was very stressful. As a new parent, we didn't really know what to expect. That's why we're super thankful for the March of Dimes. They had those advocate parents and talking us through every single thing. One thing that's really stands out to me right now is my kids came home from the NICU, so they got discharged right in the middle of flu season, and respiratory season is kind of what we call it now. But, it was a scary situation for us. We had very fragile kiddos that were coming home, underdeveloped lungs, and being able to take them out in public was kind of like a no-no. So being able to make sure that my family was immunized, my husband's family was immunized with those vaccines that were available at the time was a huge win for us to kind of feel more comfortable about having them around. And I will say one thing that was pretty cool that I learned a lot about RSV when my kids were in the NICU. And to think about it, I don't think a lot of people know much about RSV, but I definitely feel like some of these new vaccines that are coming out are bringing it to headlight. And so I'm super excited about that. But I was very fortunate that my kiddos were in a city that we had access to a home healthcare nurse that would actually come in and see. They gave both my sons the Synagis antibody treatment. So this is something that is available for critical babies that are coming out of the NICU into those respiratory seasons. And so this antibody treatment was able to protect them against the RSV, which definitely made me feel more comfortable being able to go out in public during that time, especially when my kids were, 4 pounds and not full term. So being able to still go out and celebrate those holiday seasons and be with family and friends, knowing that they were immunized and protected against the flu and RSV was a huge help for us.
Great. Thank you for sharing that. I appreciate it. And thinking about your role that you play at Walgreens, tell us a little bit about how you interface with families pretty much on a daily basis that might have some questions about vaccines.
Yes, definitely. So I think right now the buzzword that everybody's talking about is healthcare desert. So one thing that being a pharmacy, we are combating that healthcare desert. So a healthcare desert is really considered, you might live in a town where you don't have a doctor nearby. You have to drive an hour just to be seen for some healthcare. But I will say that most cities have a local pharmacy right on your corner. So being able to kind of combat that healthcare desert status is something that pharmacies are really doing something about for across America right now. So at any given time, you can walk into a Walgreens pharmacy or any kind of pharmacy and get your immunization. You have access to a pharmacist who is very knowledgeable about any of the immunizations that you might personally need or be eligible for. So this is a huge win for those healthcare deserts where they don't have access to all that healthcare. And being able to, again, walk into a pharmacy and talk to a patient customer and say, hey, I'm here to get the flu vaccine. Oh, well, have you had your COVID booster as well? Do you know about the new RSV vaccine that's out right now? You're eligible for that. And you can actually get all of those today. And, we run it through your insurance and get you out the door in 15 minutes. So it's just a huge win to be able to watch these patients come in to get their vaccine, get them taken care of, and know that they're leaving protected.
Thank you. We appreciate that. And I think it does make people feel better knowing that in their community, they can find access. I think that's a big win. So thank you. Thank you for sharing your story. And thank you for sharing where you work and how you interface with families every day. I'd like to next introduce Eddie Lambert, who's also joining us with his own personal story about being a dad of 4 girls and how he tackles vaccines in his family.
Great. Thank you. Hello, everyone. I'm glad to be here today. Yes, as you mentioned, I'm married. I'm a dad. I have 4 daughters. And yes, vaccines are very, very important to us. I can remember back in, say, 2005, 2006 timeframe, my wife and I were having some problems with actually getting the flu. And I remember us saying, hey, we just really need to go ahead, sit down, make a commitment, and start getting the flu vaccine. We've even done that. We've continued that now as we have our daughters. In fact, we've even lined them up, if you will, made an appointment, gone over to Walgreens, got everyone together, and got the flu vaccine together as a family. So I think that's something that's important to see for the kids, to see that their parents are willing to get the flu vaccine also.
Great, thank you. So what Eddie didn't tell people is that he also is a volunteer at the March of Dimes, and he serves on one of our boards and has a special relationship with us as one of our national service partners. And so, Eddie, can you tell us a little bit about your fraternity that you work with and how you guys work in the community as well?
Yes, as you mentioned, I'm a member of the North Carolina board for the March of Dimes. And yes, there is a wonderful relationship that we have with the March of Dimes. March of Dimes is a program, an organization that we work with on a regular basis. Every year we have fundraising. We have friendly competitions between the chapters within the organization. In fact, I've been the chair for the local walk here in the North Carolina Triangle area for the past 2 years. Some of the things that are important to us is we noticed that March of Dimes actually helped put together some legislation around testing for sickle cell disease. Sickle cell disease is actually rather common within the African-American community. And so that's one of the reasons why that it's important to us. Again, as you mentioned, I'm a member of Alpha Phi Alpha Fraternity Incorporated. And Alpha Phi Alpha Fraternity Incorporated is the oldest intercollegiate African-American fraternity here in the world. We were founded on December 4th, 1906 on the campus of Cornell University. Another area of interest to us is that recently the March of Dimes has entered into a partnership where they are now reaching out to doctors while they're still in medical school and talking to them about how they can become more knowledgeable and prevent implicit bias that they may have in their future patients. So that's another area of interest to us and why we enjoy the partnership that we share with the March of Dimes.
Great. Thank you, Eddie. I appreciate it. All right. So the next person I'd like to have talk a little bit about her story is Dr. Neiman. Maurine, if you don't mind typing in and letting us know how things happened in some of your personal story and some of your professional work.
Yeah, thank you, Erin. And I wanted to take a moment, even before I introduce myself, to acknowledge all the great work that Brittany, Eddie, and Dr. Correa are doing with particular regard to health equity. So having these pharmacies available that in places where there might not be good healthcare access and maximizing knowledge of issues like implicit bias and maternal access to vaccines is incredibly important. So I'm very grateful for all that work. On my own side, I'm a professor in biology and in gender, women, and sexuality studies at the University of Iowa. I'm also a Provost faculty fellow for diversity, equity, and inclusion. And finally, I am an advocate for Vaccinate Your Family. And it's probably primarily in that role that I'm here today. And I connected with Vaccinate Your Family because of a really tragic incident that I had to experience as a mother in 2020, when my otherwise healthy, nearly 3-year-old son, JJ, died suddenly in his sleep after experiencing less than 12 hours of symptoms from what seemed like a mild case of some sort of viral infection. Turned out to be influenza. He had been vaccinated that season, but as many of us know, no vaccine is perfect. The influenza vaccine is the best we can do. It's especially imperfect, but it's really the only way we can protect ourselves right now. So when we have imperfect vaccines like the flu vaccine, we really need to have the community vaccinated at especially high levels to provide protection for the vulnerable, like young kids and elderly, and people that we don't even know are vulnerable. So JJ seemed to be healthy. We found after his death, he probably had some intrinsic vulnerabilities in his lungs that might have predisposed him to a sudden death, but invisible factors, in a healthy, really vibrant child. So vaccination is really important to me as a scientist. Vaccines work. They prevent deadly diseases, and vaccines are also really important to me just as a person and as a mom who lost a child. JJ might still be alive today if community vaccination levels were higher. So I want people, when they get vaccines, to not just think about protecting themselves, but think about protecting their communities.
Wow, thank you. That's pretty strong. And thank you for sharing that. I know that that's not an easy story to always share. But I think you brought up some really valid points around that social conscience, right? Sometimes it's not just about you, it's about the people who are around you and the people who cannot be vaccinated, and how critically important it is for all of us to do our part when we can be safely, so that we're protecting our whole community. So that's really, really important information, and I appreciate you sharing that with us. Next, we have Dr. Correa. So she is going to talk to us a little bit about her perspective in OBGYN world and women's health.
Hello. My name is Nereida Correa. I'm the faculty of the Albert Einstein College of Medicine in the Department of Family and Social Medicine, and also Obstetrics and Gynecology and Women's Health. My real job is being an obstetrician gynecologist in the Bronx and taking care of pregnant women, prenatal, intrapartum, and postpartum, and also when they're having the well women care. Also, I love teaching, and my part in the students' curriculum is introduction to ethnic diversity, inclusion, and ways to combat health disparities.
Great. So you have lots of experience working with women. So could you talk a little bit about when you meet a woman who is pregnant or thinking about getting pregnant, what's the conversation that you're having with her around vaccines?
So I also forgot before I go on that I'm also the past chair of the board of the National Hispanic Medical Association, and that we do a lot of activism also with vaccines, especially COVID vaccination. So to answer your question, I am passionate about vaccination, especially during pregnancy and also in prenatal care. So and preconception. So when women come and say, I'm thinking of getting pregnant, one of the things that I like to do is to check to see if they're up to date with their vaccines, because there are certain vaccines that they can't take once they are pregnant. So if they have the measles, mumps, rubella, and hepatitis, and some of the other more live vaccines, then that is a plus. And then during pregnancy and prenatal care, I like to introduce them to the flu vaccine as soon as it is available, because it doesn't matter what stage of the pregnancy, you can have your flu vaccine and prevent having influenza. And as with Maurine's very sad story about her son, I think that herd immunity and the more people in the community that are vaccinated, the better it is for all of us, especially elderly who sometimes vaccines don't take. once my patient is 28 weeks, I offer them the tetanus, the Tdap vaccine, and that the selling point for my patients is that it does protect the baby for the first 6 months of life, because the baby would then be, by that time, have their own immunizations. And that's going to be true also for the RSV, because there's good data to show that vaccinating the pregnant woman will protect the baby for at least 2 months of life. And that's enough time, again, for the baby to begin to get their own vaccinations. Postpartum, we catch up vaccines. We make sure that anything that they were missing, they get. One of the key ones is varicella, which sometimes people do not have vaccines for, and we give it to them before they leave the hospital. So I think prenatal care is an excellent time to take care of women and meet their needs. And sometimes you really don't have them as a captive audience for a whole year like you do when they're pregnant. So it is a great opportunity to give women's health care in every respect.
Dr. Correa, you said something that Dr. Neiman also mentioned, and that is that vaccines are safe. When you're having these conversations with women, especially pregnant women, do they ask you these questions? Like, how do you talk to them about their hesitancy if they are worried about safety?
Well, they're always worried about safety because, they're told not to eat certain things and to be careful about exposure to environmental hazards. So the minute they just say the vaccine, they start nodding their head because they don't want to take anything in that could be harmful to their baby. But as soon as I tell them that it's safe for them and it's safe for the baby, they are more willing to accept. There will be some women who will not want certain vaccines. But we learned a big lesson with COVID. We found out that the COVID vaccine was safe in pregnancy and that women who had the vaccine were less likely to get COVID, or if they got COVID, it would be a milder form, so that we were able to demonstrate that not only did the vaccine protect the women, but that the babies after birth also seemed to be protected. So that's the other vaccine that we offer, all of our pregnant patients, the most recent COVID vaccination.
Great. Well, thank you for sharing that. I think that's critically important for anybody who might be listening in, who's thinking about getting pregnant, or is pregnant, or has, a significant other who might be pregnant. I think that that's something that runs through everybody's mind, is how safe is it? And knowing that it's safe and knowing that you are protecting not only the mother, but in some cases and in some parts of the pregnancy, the baby, is even a bigger benefit that parents might not even know. I don't think everybody knows that that's a benefit.
There's like word of mouth kind of thing out there that if you get the flu vaccine, you're going to get the flu. So I always have to tell them, no, you're going to get the flu. If you happen to get the vaccine, you may not get the flu. So, the word of mouth and advice, sometimes from relatives, sometimes works against the message, where it makes the patient reluctant to accept the vaccination.
A very good point. Well, thank you very much. So, I'm so excited to have all of you on this conversation with me, because as the March of Dimes, as many of you know, vaccines is where we started. Polio vaccine is where March of Dimes really got their beginning. And we've continued to really work with families on education and making sure they feel comfortable and answering those tough questions that families have. So having this conversation with each one of you that come from different aspects of life, whether it's at a pharmacy or as a national service partner, a physician, a doctor, you're really thinking about all the ways in which we interface with other humans, which way we interface with other families, and how important this isn't just one issue or one person's issue, it's all of our issue. And we really want all of us to be as safe as possible. And immunizations are one of the best ways that we can protect all of us. So I appreciate that each of you shared your story. And before we wrap up, I just wanted to give a chance to ask like an overarching question if anybody wants to answer, but thinking about who might be listening in, and it could be just about anybody, what would be like your last thing that you would say, like if you could say one thing to a mom, a dad, or even a healthcare provider around vaccines, have any like parting words? Like what's the one thing you might want to say? And anyone, I won't call on you and make you nervous. You can speak up as you want to.
Well, I will say that we learned that influenza infection had likely been a causal factor in JJ's death. How incredibly grateful my husband and I were that we had him vaccinated. And I know that there are many wonderful parents out there who lose children to vaccine preventable or vaccine modifiable diseases that did not vaccinate their children. And I'm not at all blaming the parents. I think what's more at fault is a giant systemic issue with mistrust of science and misinformation. That said, if the worst happens, you want to know that you've done everything you can for your child, which I know is what parents want to do. So vaccinate your kids. You just don't know what might happen. And probably what will happen because you vaccinate them is that they will be fine. They will not get these diseases, or if they do, the diseases won't be as bad.
Well, I just want to add again, the vaccines are totally safe. The biggest side effect is probably a little pain in your arm after the vaccination is given, but that having the vaccines is the best way that you can protect yourself and your children.
Thank you.
Yeah. I would like to also add just a couple of things. First and foremost, yes, the vaccines are safe. Again, I can give a testimony there that not getting the vaccine, that was something that we were experiencing within our family, ending up with the flu. So once we started getting the vaccine, we have not seen a case of flu within our family. And again, that's going on, I would say, over 20 years now. So again, the vaccines are safe. They work great. And I also should give a nice spotlight to the March of Dimes, because one thing that we also do within our fraternity is we have a national program. That program is called, that program is called Project Alpha. Project Alpha is a program that we perform. It's a workshop that we have with young men. Usually they are teenagers. We talk to them about safe sex. We talk to them about the role and responsibilities of males within a relationship. We also talk about teenage and adolescent pregnancy. So we partner with the March of Dimes for that. And we certainly appreciate the support of the March of Dimes with that program.
Thank you. We appreciate your partnership as well.
As far as, if you're pregnant and you about vaccines, speak to your healthcare. That kind of stands out to me, knowing that I could have gotten an RSV vaccine that is now available on the market to protect my kiddos, so my kiddos wouldn't have had to go through those antibody treatments. I take a shot for my kiddos and, have to have them go through that kind of pain. So just being able to with either your healthcare provider or your local pharmacy, go see your pharmacists and that are out there, and which ones that you're really needing to get up to date.
Great. Thank you for that. Well, thank you to all of you for taking this time to talk to all of us. I hope we get lots of viewers who maybe had questions, and maybe what we talked about today will help them make a decision to either go talk to their provider, talk to a family member and help them to make a good decision around vaccines, or even maybe go to their pharmacist and get them. So I appreciate your time, and thank you very much for joining us today.
Thank you.
Thank you.